Oh, sorry, over here on the, okay, great, yeah, thank you.
Here's your microphone.
I have a macular degeneration now for many years, and on the left eye, and at the beginning, my right eye was really good, everything like that. I can drive and everything like that. And later on, the right eye get better, same thing. And now I see the far away, but if I think anything about reading or writing, I cannot do it at all. And so that's the worst. Then now I get some medication, so the lutein and zeaxanthin. In some your advice was there over 10% lutein and 5% zeaxanthin. Are they really help?
If I can answer that one, they are a help, but they are not a help on their own. You need to add those products to the regular multivitamin. So I would encourage you to go get Ocuvite or Vitalux. Either of those products has both the vitamins and the lutein and zeaxanthin mixed into it. And so the idea is it will help slow down. It will not make your vision better. It is meant to keep your vision from getting worse as quickly. But you should be on both components. Just taking the lutein and zeaxanthin is not as effective as taking the combination product.
I see a question right here. I can put your hand up.
Do any of these vitamins help people with Stargardts? Because it is a form of macular degeneration, but I know it's different. It's genetic.
It is different, and I think the answer to that is we don't know. The difficulty is to find 3,600 Stargardts patients and follow them for 10 years is a whole lot different. I think that if I were somebody with Stargardts, knowing that it's a form of juvenile degeneration of the macula, it also affects the pigment cells, I guess I would say it can't hurt. I don't know that depending upon the stage you're at, I don't know how much it'll help or whatever, but they have done lots of studies that have shown in the age-related folks, there's no harm to the vitamins. My only reason for not recommending them in other eye diseases is they've never been shown, and it is a cost. And so I hate recommending something that has a cost without a benefit. But you can certainly see where the similarities between the two diseases would say, until they come out with something better like an inherited gene therapy, I would say I could justify recommending it to my Stargardts patients, but there's no proof for it.
Okay, just one other thing, then I'll let it go. I know that at one time vitamin A was considered a problem for people with Stargardts. So the vitamin A or the carotene, beta-carotene, is no longer in that formula. Apparently, you just said, eh?
They've taken the beta-carotene out of all those products, but beta-carotene and vitamin A are totally separate. Vitamin A was a therapy they used to use for some of the retinitis pigmentosa patients. The problem with that was they didn't show a clinical benefit. They could only show on something called an ERG a benefit to actually the vitamin A. And so that's sort of fallen by the wayside mostly, I think because we also have better things coming. But beta-carotene is completely separate. Beta-carotene is basically the carrot vitamin. You know, if you look back to 80 years ago when our grandmothers all told us to eat more carrots, there's something in it.
Dr. Mary, you made reference to certain treatments being approved or not approved. I'd appreciate more comment on that. Approval by whom and on what basis?
Yes, thank you for that question. I mean, as Dr. Sheidow was talking about, it's once you have a treatment and you've gone through all of the different phases of clinical trials, you've got great data, you know that there's a benefit, and you know that it works. The next step in our wonderful country where we have, you know, we were talking about how OHIP pays for these approved drugs for AMD. We have many different levels of government that make decisions about who is going to pay for what, and that decision about who's going to pay for what doesn't get made until a regulatory agency can judge, oh yes, this is safe, and we'd like to have it in Canada. So there are sort of about at least 3 different layers of approvals where It has to be recognized as safe in Canada. There's a body called Health Canada. So a good example is actually the Argus 2 device, the bionic eye, where Health Canada said, I think it was in 2014, yes, this is safe. We can have it in Canada. Bring this in Canada. We can be open about it being here, but nobody wanted to pay for it yet. And so this is a process where the Foundation Fighting Blindness actually was able to make a donation to Dr. Devennier's research in Toronto, where we helped to pay for the first patients to help to get some data and show actually this device is making a positive impact, again, on the quality of life. That it's not just people can have better outcomes with their vision, they have improvements with their quality of life. And we actually had back and forth with a body in Ontario called Ontario Health Technology Assessment, where we had to go back and forth, and they'd say, okay, well, what is it like for people who could be eligible for this? And we give them some data, and they'd say, oh, I don't know about that. And then, so we actually had to go back and forth a number of times. We've had a number of meetings with them. They were at our Vision Quest event last year in Toronto, and they've told us that the recommendation is to approve it to be paid for in the province of Ontario. So this is, we're going to be doing our Vision Quest tour. I'm so glad to be kicking off in London, but unfortunately in many other cities that aren't in Ontario, I won't be able to say it's going to be paid for in your province. And I think that inequity is unacceptable. So that's part of the work we do at the Foundation. I hope that example helps to show.
Okay, someone's been waiting very patiently on this side.
Dr. Mary, question, where does the stem cell therapy, where do you get the stem cells from?
That's a great question, and I could give you a very long answer, but I'll give you a top level, and anybody who wants to talk stem cells, you can find me at the break. So there's a number of different sources that you can get stem cells from. The first and the longest one we know the most about is embryonic stem cells. It's from when an embryo is first developing, scientists can get it developing in a dish, and there's a stage where nothing is differentiated yet. Like those cells have the potential to become any cell in the whole body. So that's one source, this embryonic stem cell. Many of the clinical trials that are ongoing for AMD involve actually these human embryonic stem cells. Another source, and there's an AMD trial running in Japan right now, involves a type of cell called induced pluripotent stem cells. This has been an amazing scientific development just over the past 10 years, where you can basically take a patient's skin cells. You take a little skin biopsy, and then you treat the cells with a cocktail of various growth factors, and you can get the skin cells to go back in time, to de-differentiate, to become a stem cell. And then you take those stem cells and you make them into the retinal cells that you need. Those are the two main cell types. Another one that I'd like to point out is there's various parts in the adult body where you can harvest stem cells. So a group in Toronto actually discovered retinal stem cells, and that's where I did my master's research at the University of Toronto, working on the retinal stem cell project. So if you look at your neighbor, you can see there's kind of a black outline around the iris of your eye, and that kind of black outline there, if you do a dissection, you can harvest out retinal stem cells. And the only types of cells that those will make are the kinds of cells that you need to build a human eye.
Great. We got a question on this side of the room. Yeah.
Yes, hi. I have retinitis pigmentosus. I'm legally blind, and I also have MD and a macular hole in my right eye. Is it too late for me to do the vitamins? And I also don't have anybody in the family with none of the diseases.
The vitamins don't help people with RP, at least not that we know of. And it depends, RP being, as Mary suggested, a group of different diseases. You've got RP that affects your center vision, you've got RP that affects your side vision, and you've got RP that affects both. Depending upon the kind of RP you have, the answer to your question about the vitamins and the macular hole that you mentioned is important. The vitamins haven't been tested or shown to help RP patients, and a macular hole only affects your very dead center vision. Macular holes can be repaired surgically, but only if they've been there for a relatively short period of time, certainly we prefer less than 6 months, less than a year. If it's been longer than that, you wouldn't ever try to fix it usually. And if you had the kind of RP that was affecting your center vision as well, the likelihood of a benefit to your quality of life of fixing a hole would be very small. And so the macular hole, I would certainly say, does not benefit from vitamins at all.
Yeah, because I see Dr. Hooper
Yeah.
at the IV Institute.
Yeah, and if there had been a hole that was fixable, Phil fixes them. So I would say that the answer is no, he doesn't think you should have it fixed.
Okay, thank you.
I'm just looking at our mic runners to see if we have anyone else, or certainly raise your hand. Okay, someone. Yeah, thank you.
Good afternoon. Outstanding presentation. I'm just wondering about any research that has been done about the use of kale and spinach.
Kale and spinach, just like carrots, there's something there. Kale and spinach, I mean, if you look at back when we couldn't produce lutein and zeaxanthin, the reason that those became highly interesting foods are because that anything that has a deep color, both kale and spinach do, have lots of lutein in it. And so that's where the idea of supplementing lutein and zeaxanthin came from. Diets rich in those foods did better. At this point in time, could you take extra of those in your diet? Sure, won't do any harm. You're supplementing the supplement, but that's okay. Especially when you take things like kale or spinach by mouth, or carrots for that matter. It's pretty hard to have too much food. Your body regulates that pretty well. But essentially, the benefits of those come from the lutein and zeaxanthin that we're already putting in the supplement.
Question over on this side, middle.
My question is, I was at the heart doctor the other day, and I told him I had wet macula, and I wondered if eliminating a lot of the blood thinners for 2 or 3 weeks would help dry it up or correct the problem. He couldn't answer it. Maybe you can.
Sure, I get lots of people who are on blood thinners, and there's so many new blood thinners out there that it's becoming a bigger and bigger issue. A couple of points to that would be, blood thinners don't make you bleed. If you're bleeding, blood thinners make you bleed more. And so I don't stop any blood thinners for anybody getting injections. You might get a little more redness to your eye, and you may look a little less pretty in the mirror the day after a needle, but the needle itself doesn't need you to stop the blood thinners. As far as drying it up, no, I don't think it'll help you dry it up any quicker. And as long as you're on blood thinners for a good reason, and I assume your heart doctor has you on them for a good reason. Some people are on them for irregular heart rates or because they're at risk of strokes and things like that. I think the important thing to remember is if you have a stroke, you're going to worry less about your vision, so you want to avoid having the stroke. And so my answer to all my patients is, don't stop your blood thinners for this.
Now, I think we have time for 2 more questions. I thought I saw a hand up over here, and then we'll do the final question over here.
Can you tell me anything about giant cell arteritis?
I'd love to defer that one to Mary, but that would be really unfair because it's not even up her alley either. Giant cell arteritis is an inflammatory condition. So different than, so please don't hear me saying the same, but to give you an idea what that means, it's like rheumatoid arthritis or lupus. Inflammatory conditions are conditions that attack blood vessels, better termed a vasculitis. Giant cell arteritis is a condition that attacks blood vessels. And specifically with regards to the eye, the risk is that it could attack the blood vessels that feed the central retinal artery. And so people can get total blindness from giant cell arteritis, and it's not reversible. The reason we always try to distinguish the giant cell arteritis cause of that problem from the non-giant cell arteritis is the risk to the fellow eye. And so if someone was to come in with a blocked artery to the nerve, and we presumed that it was that problem, we aren't doing blood tests to figure out what we can do for that eye. We're doing blood tests to make sure that we're trying to lower the risk to the other eye. Hope that's helped.
Hoping to sneak in a kind of two-parter. The first one, just clarification from the Stargardts question earlier. We had Stargardts as a later diagnosis, and so our approach to nutrition has been to limit vitamin A, but we are taking the Vitalux. Is that sort of a good approach to limit progression of it?
I'd love to have Mary's opinion. I guess I would say I know no reason not to take it. And I always sort of look at it like the glass is being half full. If you can slow down the disease a little bit more, great. I don't have any reason to discourage it. I certainly don't have any proof that it helps, though.
Okay. And then for the Argus 2 technology, would that be applicable to Stargardts, or would it have to be, the disease have to be progressed to a certain point?
At this stage with the technology, I should point out the 2 means there was an earlier technology, a 1, and Argus is not the only company, Second Sight, that's developing this type of artificial vision approach. This is kind of, an area of research where there's a lot of growth. And so the current technologies that are approved only really work if you have, as I said during my talk, no light perception. But there are some studies in the UK, I don't know if you're familiar with this trial, where there's patients with age-related macular degeneration, where you have a similar pattern of vision loss to Stargardts, where they've been putting the Argus device into AMD patients and seeing some vision improvements. Have you seen that study?
I haven't seen that one. There was a recent one a bunch of patients have asked about with the implantation of a monolayer of pigment cells. But to your point, and to plug the foundation registry, I think Stargardts is one of the diseases that's primed to be a gene therapy candidate. And I say that because some of the Stargardts, there is a specific gene to target, which is what you want, unlike macular degeneration. And so if you were picking a disease that I think people would like to target with a therapy, it's Stargardts. And that's where the registry comes in helpful. When a company brings a drug to Canada, to Health Canada, to say, we want to run a study, we want to see if we can help patients, then the problem gets finding those patients. And that's where a registry can really be helpful.
Yeah, and just to add, one of the challenges with Stargardts gene therapy, at the Foundation Fighting Blindness information table, we have a take-home sort of summary of all of the different gene therapies that are currently recruiting patients. There is a Stargardts trial. I think the recruiting site's in Portland. But the challenge with Stargardts is that genes are all different sizes, and the Stargardts gene is very, very big. And so we're actually really excited about a new technology, antisense oligonucleotides, where basically, instead of trying to introduce a big gene, and instead of using CRISPR to like word process out your error, you actually use a drug to fix the gene defect after, a little bit later in the process. So it's sort of like a drug that can specifically work on genetic diseases. This is an area that's really poised for growth right now.
Thank you so much for your questions, and thank you so much, Dr. Sunderland and Dr. Sheidow, for your time.
Thank you.